Next order of business is the agenda, and we will get right to that. The first agenda item is RS24759C2, Healthcare Study Committee, Representative Luker. Representative, if you would state your name and who you represent, sir, the podium is yours.
Thank you, Mr. Chairman, members of the committee. I'm Representative Lynn Luker, representing specifically District 15, but a member of this body. We're here to review and introduce a resolution regarding providing care for the GAP population. I should say improving care. Sometimes there's the misunderstanding out there that there's no care, but we do have a network of care for that population through our federally qualified community health centers, rural centers that provide that, plus a backstop of the CAT fund. But that is obviously often inefficient and costly. And so there's a search here for a better path forward. And we have been in discussions about developing a waiver, an Idaho-specific waiver to accept Medicaid funds that have been offered under the Affordable Care Act. As other states have gone down that road, they've found significant fiscal problems, particularly in adopting the traditional Medicaid model. In Idaho, we have an advantage. We've been going down the SHIP program. We've had grants to help us turn to a managed care program. And that has been successful in moving from a fee for service model to a managed care model with better outcomes and less expense. However, that is not completely in place, and it probably won't be in place fully until 2020. And so the intent would be to move this population into that managed care program. And in order to do that, we want to make it an Idaho-specific program. And so the point of this resolution is to convene an interim committee and to work with the Director of Health and Welfare to actually prepare a waiver that's Idaho-specific, that directs, that uses managed care, that it utilizes personal responsibility models that are important to this state, that also shifts the risk from the state to those providing the care, which is the managed care outcome model. And so that is embodied in this resolution to create that interim committee with the direction to also look at the CAT fund and the indigent care model and work towards eliminating those as a part of this process. So with that, I would stand for questions.
Thank you, Representative. Are there any questions of Representative Luker or Representative Rushi?
Thank you, Mr. Chairman. I have a couple of questions. Mr. Chairman and Representative Luker, is this bill from you or is it from the GOP caucus?
Representative Luker.
Mr. Chairman, it's a combination of work that I initiated, and there were several drafts of different things floating around, and I tried to put a lot of those things in here.
Okay.
Follow up?
No, it's a different area if I could.
Go ahead.
Thank you, Mr. Chairman. So the proposal is for an interim committee. Was consideration given to the previous study groups that have been convened by the department or by the governor on this issue, including the fairly detailed proposals that have resulted in prior legislation?
Representative Luker.
Mr. Chairman, Representative Rushi, yes, and as a fact, those prior committees and the work that they've done will probably expedite the work and provide a lot of information that the interim committee will utilize. However, this legislative body has not had its own opportunity to sit down and review all of that, and as a policymaking body, it's important for us to do that in a more specific sense. We've had some minimal representation on those committees, but as a legislative body, this will give us an opportunity to work through that.
One last question, Mr. Chairman.
Go ahead.
And the Affordable Care Act was passed in 2010. We have had proposals for Medicaid expansion, coverage of the low-income Idahoans who are having health issues, premature death, as well as opportunity to capture some of the financial monies. We've had those proposals since, well, I did one in 2012, and they have not, until this year, received any hearing, and they've never received consideration by this body. And this proposal puts that decision
Representative.
off into the future, and so I can't support it.
No one figured that you would support it, Representative. I would caution everybody, when we leave here on Friday, it's time to go home and campaign. We'll leave the campaigning until then. Thank you. Further questions, Representative Luker?
Mr. Chairman, I object to that statement. That is not a campaign.
Your objection is noted, Representative. Thank you. Is there further questions of Representative Luker? I would remind everyone, this is an RS. There will be no public testimony taken today. Representative Packer.
Thank you, Mr. Chairman. This is a tough situation. It has been for a number of years, as has been noted. And it has been a tough discussion, a tough topic for everyone involved. There's so many people that have worked hard on trying to find a variety of solutions, from full Medicaid expansion, with which some truly welcome and are applaud, and others that are just really concerned with that. I am one of those that has been concerned with expanding our existing Medicaid system. For me, I believe it is truly broken. It's inefficient. It doesn't do what we need it to do in many different aspects, in my opinion. That's one of the reasons we have representative government in the U.S. is there are a variety of opinions. There's a variety of needs. There's a variety of solutions. And I truly want to thank many people that have worked hard on this, from the director who took our challenge in trying to find a state solution and coming up with an idea that unfortunately didn't get very far down the road. To a certain extent, I guess there's a piece of that even still here, and other community leaders that worked with him, to those of us in the legislature that have worked to bring a variety of ideas forward. It's an emotional discussion, and it has been an emotional discussion, and I think that we hurt ourselves when we dig so far in that we don't try to find a way forward and try to find some progress. I think that's the problem with Washington, D.C., and I hope that we minimize that here in Idaho. I'm sorry.
Representative, be careful.
I will. I'm sorry. Anyway, and so I do want to applaud those that have worked on this, and I do want to thank you, Representative Luker, for taking the ideas of many and improving upon what was here last Thursday. I was very unsupportive of what we had last Thursday, but I think that we have improved this. I do want it noted for the record that I was hopeful that we would maybe make a little bit faster track, but at least we're still moving toward finding the right solution, a waiver here in Idaho that would allow for managed care. It doesn't do it as quickly as I had hoped, but it does move it that way, where the last one didn't. And so I appreciate that. I appreciate you recognizing the needs. And with that, I would like to make a motion that we send RS24759C2, or introduce RS24759C2, and I'd actually like to recommend that we move it to the second reading calendar.
It's been moved to introduce RS 24759C2 and send it directly to the second reading calendar. Are there any further comments? Representative Redmond.
Thank you, Chairman Wood. I also would like to thank Representative Luker and Vanderwild for all the work they've been doing, trying to come up with a solution, and certainly Director Armstrong and his many staff members. What I do like about this is it's a legislative organized direction, and my understanding it'll be community-based, which is important. So I appreciate that, and also we still have whatever it comes up with in the next session in 2017 is when we'll make the final decision. So thank you. I will support it.
Thank you. Further comments? Representative Beeler.
Thank you, Mr. Chairman. Maybe just to make a comment. When I first came here to this body, and in particular to this committee, one of the very first things that I was introduced to was those people that fall into the gap. And yeah, this has been kind of an important thing. This is an important step in the right direction. And so I guess the very first thing I ever talked about were cattle, and I'm going to talk one more time about cattle, just for the last time maybe. When I got ready to take over our ranch and purchase it from my parents, I thought, well, my father's run this for a very, very long time, and I think I'm going to ask him for some advice. And so that's what I did. I said, I would like you, I want to ask you, do you have any advice for me going forward? And I was expecting some huge advice, and he did it really quickly. And he said, well, this is what I'm going to tell you. You're going to do a lot of dealings, and the thing that you need to remember, if it's not good for both parties, it'll never end up being a good deal. And I thought, well, that's not very much advice. And then he said, well, do you have any questions? I said, yeah, I do. And so I thought, well, I'm going to get something out of this conversation. So I said, hey, if you're ever pulling a calf and it's a little hard, what do you do? And he said, I just find something that moves, and I move that, and then I find something else that moves, and I move that, and eventually I usually get the calf. And so I think that's where we are right now. I know there's been work done in the past, and I would salute that work. I think it was important to bring us to this point. I think it's important today as we move forward. This is an important issue. It deals directly with real people and their real lives. And we need to make sure that we are committed for the long haul. And this is something, by golly, we got a hold of something that actually did move. And it's a movement in the right direction. And it's going to be fair for everyone in the end. And so I applaud the work past, present, and in the future that will be done to cover this most important population.
Representative Chu.
Mr. Chair, I'd like to make a substitute motion.
Substitute motion's in order.
I'd like to move that we return this to the sponsor. It doesn't cover our needs. We talked about managed care, and House Bill 260 already has us pointed in that direction. And where this bill suggests us go, it really isn't a movement that is a movement that I can see.
We have a substitute motion, which is to return the RS to the sponsor. Is there further discussion? Representative Rushi.
Thank you, Mr. Chairman. I make a amended substitute motion
Amended substitute motion's in order.
that the RS be introduced and sent to general orders so that it can be modified to meet the needs of the population of Idaho.
It's been moved to an amended substitute motion is to move the RS to general orders. Is there further discussion? Representative Rushi.
Thank you, Mr. Chairman. Without politicking, This is really a question of public policy, and further delay is antithetical to the principles of population health and financial prudence. We're wasting money, and we're exposing Idahoans unnecessarily to premature death. So further delay with another study committee will not save lives, it will not save money, and therefore I think is a wrong decision. We can fix this in general orders.
Thank you, Representative. Representative Representative Vanuatu.
Thank you, Mr. Chairman, and just to support the original motion. I know there's been a lot of discussion, why does the legislature need to look at the waiver? For the same reason this committee looked at the first RS and brought it back here improved, because they had different eyes on it. We're coming back with a better RS. That's why I think it's important to move this forward, that the legislature looks at the waiver so that we have eyes on it and improve it, not to kill it, but to improve it. And I think this process works. This is a process we use for all of our bills that come up, even RSs. Sometimes they go to amending order. Sometimes, I don't know how many times Representative Luker and I have sat across next to each other and said, no, let's change this language. No, let's change this language. And then once we brought it out, we thought we had it right and we didn't have it right and we changed it again. And I think that's the process of how we get to good legislation, is getting enough eyes on it. So, Mr. Chairman, I would support the original motion.
Further comments? The chair would just like to thank everyone who was involved in this process over the last week or so. For all of those listening and for all of those in the room, and most of you in the room are, at least to some extent, observers of the process here in the Capitol. Success is measured not in the short run, but success is measured in the long run. Success is measured by eventually getting to the point that you need to get to. A lot of us sometimes are disappointed in the speed that we get there, but typically we wind up with a better product. Everybody knew that going to expand Medicaid in the original form of original fee-for-service like we've had in the state of Idaho was never going to go anywhere. We were only going to get to Medicaid expansion when we had a system that we could measure outcomes, we could control costs, et cetera. Apparently, most of Medicaid will get to a managed care model in 2020. It's probably not appropriate to get much ahead of that curve with respect to the financial obligations, et cetera, of the state. So while there are probably many disappointed people with the speed at which the legislature appears to be moving on this topic, we've had many references to many animals and how you can whatever. I won't use another one. But the fact is that we do what we can do, and you can't get done what you can't get done. So, Representative Rushi.
Mr. Chairman, I think delay, and I've said it, I think delay is unreasonable. I also note that in the bill, it talks not just about the interim committee and working on a waiver. And by the way, I put together a plan with CMS in my prior life at Regents, and committees don't negotiate with CMS. So I really don't understand how that works at all. But the thing that bothers me is on line 2728 on the second page. Not that we'll have it done within a year, but we may request for reauthorization. Request for reauthorization. How long, good committee, how long are we going to drag this out?
Thank you, Representative. Any further debate? We have 3 motions on the table. There's not room for another motion. So we'll take up the amended substitute motion first, which is to move it to general orders. All those in favor? We'll ask the secretary to take a roll call on the amended substitute motion.
Chairman Wood,
No.
Vice Chairman Packer,
No.
Representative Hickson,
No.
Representative Perry, Representative Romrell, Representative Vanderwoude, Representative Beeler,
No.
Representative Redmond, Representative Troy, Representative Rushi,
Yes.
Representative Chu,
Yes.
Motion fails on a 9-2 vote. We'll next take up the amended motion, which is to hold in committee. Do you wish a roll call vote or no? Take a roll call vote.
Chairman Wood,
No.
Vice Chairman Packer,
No.
Representative Hickson,
Yes.
Representative Perry, Representative Romrell, Representative Vanderwoude, Representative Beeler,
No.
Representative Redmond,
No.
Representative Troy, Representative Rushi,
Yes.
Representative Chu,
Yes.
Motion fails on an 8-3 vote. The original motion, which is to introduce and send to the second reading calendar. All those in favor of the original motion?
Mr. Chairman, if I could speak to the motion.
Sure.
The motion calls for this to be sent directly to the second reading calendar. We have never had testimony, we have never had debate on this or a similar motion. They did have a truncated testimony on Senate Bill 1205. However, we have never, since Tom Lurcher presented his Medicaid expansion bill back in 2013, had a discussion on this. And I think it is improper to move this forward. We think we know what's right, but wouldn't it be wise to hear what the people of Idaho would like? Mr. Chairman, that's why I'm going to be opposing this.
We've had many discussions about this, and we've had many discussions with the citizens of Idaho. I understand that they're not here to actually testify today. But we are moving, we are making progress, we are getting to the end of the session, and we will vote on the motion. Representative Packer.
If I could just speak to that a little bit, because I do understand the concern with that, and I debated on that for a while. My concern is going home with nothing, and that's really our alternative. I'd rather see us at least get this much movement out of it than to go home without anything. Thank you.
Representative Hickson.
Thank you, Mr. Chairman. And just to explain my no vote, I'll be a no vote on this as well as the next RS, and I'll explain a little bit more at that point in time. But I don't think that putting a committee together to study this over the interim is going to accomplish what I think it's going to accomplish or what Idaho needs it to accomplish. It seems to me like the studies have been done. I think we're just down to the grassroots issue of whether we want to do something with Medicaid expansion or not. And for that reason, I'll be voting no, Mr. Chairman.
Thank you. Representative Rushi.
Thank you, Mr. Chairman, and I understand the good lady's desire to do something, but I submit that this does nothing.
Thank you. Any further comments on the motion? All those in favor of the original motion say aye. Aye. Roll call vote is requested, please.
Chairman Wood,
Aye.
Vice Chairman Packer,
Yes.
Representative Hickson,
No.
Representative Perry, Representative Romrell, Representative Vanderwoude, Representative Beeler, Representative Redmond, Representative Troy, Representative Rushi?
No.
Representative Chu?
No.
Motion passes 8-3. The RS will be introduced and sent to the second reading calendar.